UK Health Minister Lord Darzi announced the multi-million-pound funding which will be given to England's 10 strategic health authorities. They will each receive £2 million this year, followed by £5 million over the next 4 years to tackle major health issues from Alzheimer's to MRSA.
We employ 1.2 million people. We spend £109 billion. We have to always challenge ourselves to be much more innovative, whether it's an invention or taking up the invention from the benchside to the bedside. And our quality of our healthcare system is dependent on it, and also the impact on it on the economy is obviously tremendous as well. The NHS prizes are going to be challenges. We know what the challenges are. We're all living longer. We want to improve the quality of life as we grow older. We all know that we have some lifestyle diseases, obesity and others, dementia as being one other major challenge. We want to set the challenges by an expert panel who will advise us in the Department of Health what these challenges should be, and then set the best mindset in this country to come up with solutions.
A celebrated example of British medical innovation has been the rescue roll, designed to help accident victims with critical injuries.
So the idea is that I'd be outside the victims, outside the car. This would come around, and this would support the head from falling forward there. So that would stop that movement. The second part, and remember this is a time-critical victim, would be the main thoracic support, which is lighter than a football but can lift up to 1 ton in weight. This can get fed through the back of the vehicle or confined space, come across the chest like this, and it's protecting the thoracic spine all the way around, both sides. And then the tension goes around the back. So we're at this point. Okay, so I've decided that I need to use... The rescue roll came about because of an ethical dilemma of not having fit-for-purpose equipment to deal with time-critical victims with potential spinal injuries, and putting myself in a position of taking risk with the spine. So I went to look for equipment that I thought would be there. It wasn't, so I decided to design the rescue roll.
40% of global medical innovations have come from the UK, and the government hopes that with this extra funding, this proud history will be maintained and increased.